At this point in time, our first bill we will be hearing will be House File 585 from Representative Claiborne. Because Representative Claiborne is not a member of the committee, I will make the motion to refer House File 585 to the Human Services Finance Committee. Welcome to the committee, Representative Claiborne. If you'd like to go ahead and explain your bill, and then we'll go to the testifiers.
Thank you, Chair Fisher and members of the committee. We have had many conversations over the years about a shared goal to increase access to the services that support older Minnesotans and individuals living with disabilities and complex health needs to remain living in their home and with their own families as long as it is possible. This goal is now more important than ever given the strain on our congregate care settings are facing. House File 585 is a bipartisan effort written in conjunction with the Minnesota Home Care Association. It contains specific and concrete steps we can take to move in this positive direction. The bill proposes a collection of changes aimed at moving the medical assistance reimbursement rates for underfunded home care services and activities closer to being the actual cost of providing these services. The changes proposed in this bill will start to move us towards a more sustainable system of access to home care services. This is a critical piece of our work as a state to better support older Minnesotans and individuals living with disabilities and those with complex health needs to remain living independently. The bill proposes 3 changes. First, it updates the reimbursement rate for homemaker services to address the current extremely low wages that can be paid under that critical service. Second, it establishes a second reimbursement rate for a limited annual number of care evaluation visits, recognizing the actual cost required to do those care evaluation visits. And lastly, the bill requires the Minnesota Department of Human Services to work with the home care stakeholders to identify a care coordination reimbursable service aimed at recognizing at least a small amount of the care coordination work currently being performed by home care staff without reimbursement. I would like to thank Representative Keel and Chair Knorr for joining me as co-authors on this bill. I would also like to draw members' attention to the letters of support for the bill sent to the committee, as well as highlight the governor's inclusion of a portion of this proposal in his recently released budget. The proponents of the bill have been in communication with DHS about the bill for over 2 years and will continue their work with DHS on technical assistance for the bill as that is available. With me today are 3 testifiers who will speak to the need of this legislation and how it will help increase access to home care services for Minnesotans. And with that, Mr. Chair, I would ask for you to recognize Kathy Messerly, the Executive Director of the Minnesota Home Care Association.
Welcome to the committee, Director Messerly. Thank you for being here. Please introduce yourself and start your testimony.
Thank you so much, Chair and members of the committee. My name is Kathy Messerly, and I'm the Executive Director of the Minnesota Home Care Association. We're a statewide association representing home care agency members who provide hands-on care to older Minnesotans and individuals with disabilities in their own homes. Thank you for the opportunity to testify today in support of House File 585 and the changes it proposes to increase access to home care services across the state. The changes in this bill focus on nursing, rehab therapies, home health aides, and homemaker services, all services provided in the individual home. I'll go into a little bit more in depth. Thank you for Representative Claiborne for mentioning the 3 components. So first, it establishes a new reimbursement rate for a limited number of care evaluation visits. This change is aimed at implementing a reimbursement rate closer to the actual cost that providers incur for 3 specific kinds of home care evaluations. All 3 of these visits are required, and they're more comprehensive than a typical home care visit, which is the current reimbursement rate that it's set at today. This involves a more thorough assessment that takes 2 to 3 times as long as a typical visit. Service plans are developed or revisited and adjusted during these evaluation visits. The 3 specific qualifying visits are, first, the start of care, visits required at the start of a new mode of care to develop the service plan. Secondly, recertification visits. Checks are required every 60 days to ensure everything is going well and according to the service plan, and to make any modifications to the plan. And lastly, resumption of care visits. This is required if there was an interruption in the plan of care to check to see if any updates need to be made. An example would be the patient getting admitted to the hospital for more than 24 hours and then returning to the home. Secondly, the bill directs the Minnesota Department of Human Services to collaborate with interested stakeholders to identify new or existing billable medical assistance services for home care coordination activities. This section of the bill is aimed at recognizing at least a small amount of the care coordination work currently being performed by home care staff without any reimbursement. Examples of care coordination activities that the home care staff carry out include reaching out to a pharmacy or a doctor for additional guidance when there are questions about the medications, ordering additional supplies for the client, calling and getting orders from a doctor when it appears additional supports may be needed, and more. The additional reimbursement would only cover time outside of patient visits, time for which providers currently are not paid. Finally, the bill restructures the reimbursement rate for homemaker services to be more reflective of the current market data. Homemaker services are critical but often overlooked services that help an individual manage cleaning and household activities, enabling them to remain in their home. The current rate for homemaker services varies, depends on how the service is accessed, but it is a very low rate that does not allow for a livable wage to be made. Many agencies, unfortunately, have discontinued offering homemaker services because they simply cannot hire anyone at such a low wage. Our home care service providers around the state tell us time and again how the low medical assistance reimbursement rates make it extremely challenging to pay a sufficient wage to recruit and retain home care staff. This translates into more and more waiting lists for individuals who need the services. A growing number of Minnesotans without access to home care services are turning to more intensive, expensive, and currently overstressed facility-based care, such as hospitals and long-term care facilities. Our state can and must do better in providing older Minnesotans and those with disabilities and complex health conditions the supports they need to live full lives. MHC is grateful to have two individuals here today to testify about the challenges they're facing due to the current rate structure to ensure clients have access to care. I ask for your support of this bill, and I'm happy to address questions.
Yeah. Thank you for your testimony. We'll go on to the other testifiers, and then we'll go to questions and comments at that point. Next on the agenda, I have Sarah Skorberg. If you'd like to come forward, introduce yourself, tell us who you're with, and begin your testimony. Welcome to the committee. Please introduce yourself.
Hi, Chair and members of the committee. Thank you for the opportunity to testify today. My name is Sarah Skorberg. I'm a licensed social worker, and I'm a care coordinator at Thomas Allen, Inc. In my role, I work with Minnesotans who are 65 plus and live with various disabilities and mental health diagnoses. I work to support individuals' ability to remain independent in their communities as they age, by assessing their eligibility for in-home services and helping them make informed choices about their end-of-life care. Thank you for the opportunity to testify today in support of House File 585, specifically the portion of the bill that would restructure the reimbursement rate for homemaker services. While the current reimbursement rate for homemaker services varies slightly depending on how a person is accessing the services, it is across the board a very low reimbursement rate that makes it very challenging for service providers to be able to offer a livable wage. As a result, access to homemaker services is greatly limited for Minnesotans with disabilities and older Minnesotans, meaning they often have to turn to more expensive services and at times have to move out of their homes and communities and into congregate settings. I've spent many hours scrolling through provider lists, consulting with my coworkers, and calling agencies, often being told that the staff that they have available for homemaker services are unwilling to work at the current homemaker rate and take on new clients, or that they do not have any staff available. I've been in my current role since September 2022 and have yet to see a client on my caseload be successfully set up with homemaking services. I'm finding that as I meet with clients for the first time, they mention that they have been recommended for homemaker services but don't understand why they have not received help. I find that they have usually been sitting on a wait list for many months and that they just didn't know it. I've also had a handful of clients lose their current worker and go without services because a new one cannot be found. I have a client who is 95 years old and lives with her son, who provides personal care assistance and homemaking services to her. Her son continues to tell me that he can't pay his bills on the current rate, even though he provides nearly full-time paid care to his mother, and that he's burnt out on his job. I continue to try to provide him options for finding a worker through an agency, but there are none available. I worry about the quality of care that she's receiving, the effects on her family's well-being, and how much longer they might have to wait for a worker to be provided. When clients cannot rely on in-home services, they often go without assistance or their families scramble to meet their needs. And this is just one example of how this service access issue is affecting my clients and older Minnesotans across the state. This is something that percolates my office space regularly. We share frustrations that our clients continue to go without services, we worry for their care, and we feel helpless as providers who regularly see these gaps in care that we cannot easily change ourselves. If we as a state value supporting older Minnesotans and those with disabilities and complex health needs to remain living in their own homes and communities, and to avoid accessing more intensive and expensive care, we must address the access barriers to services like homemaker services. The proposal in this legislation to align homemaker reimbursement rates to be more reflective of the actual cost of providing the service will help increase access to this critical service and support more Minnesotans to live in their own homes and communities for as long as possible. Thank you again for the opportunity to testify today.
You're welcome, and thank you for being here. And if you'd like to have a seat again, I will call up the next testifier, and if we have questions, we'll go to those afterwards. The next person I have is Susan Morgan. If you'd like to come forward, please. Good afternoon. Welcome to the committee. Please introduce yourself, who you're with, and start your testimony, please.
Thank you so much, Chair and committee members. My name is Susan Morgan, and I am the Chief Operating Officer at Accra. And I thank you so much for the opportunity to testify today regarding House File 585. Accra is a nonprofit organization founded 30 years ago to focus on the underserved. Our mission is to improve lives by providing support to clients who may be chronically ill or disabled. Our services are available in all 87 counties of Minnesota, helping people to live their best life in their own community. At Accra, we see every day how the underfunding of various home care services and activities impacts those Minnesotans who are in dire need of these services. I'm a registered nurse who has worked in the home care industry for over 40 years. For the past 20 years, I've worked both in public health and now for a nonprofit company called Accra Care. Both of these entities primarily serve clients who rely on care that is reimbursed by their medical assistance benefit. The section of this bill proposing an update to the reimbursement rate for homemaker services is crucially needed. Over the years, I've seen that homemaker service is commonly the first home care service that a client needs. As the body declines, these homemaker tasks become more difficult to manage independently. Unkempt homes with loads of laundry undone and dishes stacked high, attracting all kinds of vermin, was something that we regularly saw at public health when investigating vulnerable adult cases. We would often refer these individuals to homemaker services. Years ago, the reimbursement rates were adequate to attract and pay the staff to provide this type of work, but that is no longer the case. The homemaker rate lags behind a reimbursement rate that an agency needs to be able to offer homemaker staff a livable wage. If we cannot staff this simple but needed service for our clients, it only results in more admissions to congregate living, which under Medicaid is far more costly. In addition, home care agencies have for years absorbed the high cost of starting or resuming care for a client in the home. An RN must do an in-depth evaluation visit, which can take 2 to 3 hours in the home, as well as another 2 to 3 hours of documentation once back in the office. This is done to comply with state and federal standards of care. We are reimbursed for those visits no differently than a regular home visit that may take up to an hour for the visit and the documentation. And as you can imagine, it's very challenging to make this service work when money is lost on these in-depth evaluation visits. The section of this bill proposing for a separate care evaluation reimbursement is aimed at finally addressing this challenge. Another task that home care agencies are not reimbursed for is care coordination. This involves advocating for clients in many ways. It might be to track down necessary equipment or medications that a client was not sent home with from the hospital. Another example is realizing that a client is in need of better nutrition, so you need to make arrangements for them to access Meals on Wheels. Or attending a care conference in the home with the family when it's time to consider moving their family member to a place that can better meet their needs. None of this is currently a service that an agency can bill for, and yet they do the work to assure that the clients are well cared for. However, it is these unpaid services that limit providers' ability to meet the community need for home care services. The section of this bill calling on the Department of Human Services to work with interested stakeholders in identifying possible reimbursement mechanisms for a portion of these care coordination activities would be of great help. The Minnesota Home Care Association has, for a number of years, brought forward reasonable proposals to help increase access to needed home care services for Minnesotans. Decreasing these barriers to home care access is now more important than ever, as more and more Minnesotans are growing older, and our congregate care settings are becoming more and more overly stressed. I ask for your support for this proposal to help more Minnesotans across the state get access to the supports they need to remain living in their own homes. Thank you so much.
You're welcome. Thank you for your testimony. Committee, we are now open for questions or comments. Are there any questions? Representative Edelson.
Thank you, Mr. Chair, and thank you, Representative Claiborne, for this bill. I think it's so important. It's funny, you know, some of the things that I think lawmakers should go and work in these fields sometimes, right? As I'm looking at just the care coordination activities of what should be reimbursed and what shouldn't, and how it all works, and making sure and you have to come before us to make this happen. And I'm sure you've been probably coming for years on this bill, is that right?
That's right.
And in the meantime, people are not getting reimbursed for this because we're not getting the job done. Well, I think it's really important. I think this is a great bill. I guess the one thing on page 9, when you look at 9.6 to 9.13, it's looking at that care coordination activities may include. I guess what I want to know is the people that you're caring for, were they consulted in making sure that these are the things that they also feel like it's going to be enough? How did you, I guess, Representative Claiborne, I don't know if it's you or some of the members that you have testifying.
I would like to
Representative
ask
Claiborne?
this. Thank you, Chair Fisher. If Ms. Meserly could come back to the table, I think that would be the best.
All right. Director Meserly, if you'd like to come back. And Director
Thank you,
Meserly,
Chair.
go ahead.
So your question was whether or not we've consulted with the folks doing the care coordination?
Representative Edelson.
Mr. Chair, my question was if patients, if the people that you're caring for, if they were consulted. I mean, I know that this is probably, I guess, if you're owning one of the home care services, you kind of come up with this. Is this kind of the exhaustive list of what you are sure you need, and that when it's managing documentation, supporting transitions, managing medication, were there other things that, was there like a survey done for the people that you're caring for, I guess is what I want to know.
Director Meserly.
Chair, Representative Edelson, there was not a survey done. These are required services, required coordination of care that they would be doing, so we did not do a survey.
Representative Edelson.
That's, I think, Mr. Chair, that's it. I guess I would love to chat with you online to see kind of what your ongoing process of reevaluating these things look like.
Okay, very good. Representative Chair Knorr.
Thank you, Mr. Chair. I don't know who will be able to answer this question. It's page 5, line 5.3, subdivision 16. So the question about rates established by the commissioner, this references the 256S21 up to 256S215. Maybe nonpartisan staff can help us understand what that rate framework is and how will that be, funded.
Certainly, Chair Knorr. I would look over to our nonpartisan staff to figure out who would be the best to answer that. Staff person Punelli, thank you.
Mr. Chair and Representative Knorr, I believe you're asking about the elderly waiver payment rate methodology.
Chair Knorr.
Mr. Chair, Ms. Pinelli, yes. And at least this also includes CADI waiver, BI waiver, and the other waivers, CAC, included in that list.
Ms. Pinelli.
Mr. Chair and Representative Knorr, currently those waiver services that are listed have a rate phase-in. There was a change in the rate methodology a few years ago, and what was done is most of the rate is still based off of the old rates. I think about 81 or 82% is still based on the old rates, and only about 18 or so percent is based on the new rate methodology. So I think what this is doing is it's changing that. So for home delivered meals, I think it's getting rid of that phase-in. And it's also making some other service rates exempt from that phase-in.
Chair Knorr.
Thank you, Mr. Chair. Thank you, Ms. Pinelli, for the clarification. I think there's more looking into the phasing and rate frameworks and all that, how it intersects with how we do the funding for some of these programs. Thank you, Mr. Chair.
You're welcome.
Thank you, Representative.
Any other questions or comments? Hearing. Oh, Representative Keel.
Thank you, Mr. Chair, and Representative Cleavorn. I appreciate having been involved in this type of service. It is not that I worked it with anybody. I do unpaid help for family, which is fine. It's a reward in itself. But my point is that it's a very visible help when you're not expecting to see somebody struggling with something and you're doing dishes, or you see that they're failing in being able to care for themselves. And so I always wonder about the people who don't have families that can observe, oh, there's a problem here. Because often if you are having trouble with your laundry or your dishes, you're often having more trouble with something else health-wise. So it's an important issue. I would say that we have a problem. I don't know as we're going to hire people for it, because we're having a hard time hiring people for all kinds of things. But it is an important service. It would do well for a college student to look for this to be one of their jobs when they're, going to school. But anyway, I just wanted to reiterate that this is an important service. So thank you.
Thank you, Representative Keel. Representative Claiborne, I don't see any other questions. Any closing comments?
Well, I would just like to say thank you to the committee for letting us have this bill heard today. It is a bill that is truly about having dignity in one's home and having the ability to continue living in one's own home as long as possible. And as Representative Keel, you have said to me before, this impacts everybody, no matter what stage of life you're in or where you live across the state. And I appreciate your compassion and your appreciation for that need. And whether you're in the Twin Cities or out in greater Minnesota, this is something that we all need to consider. Thank you, and I ask for a green vote.
Thank you, Representative Claiborne. I renew my motion to refer House File 585 to the Human Services Finance Committee. All those in favor say aye. Aye. Opposed, say nay. Motion carries. This House File 585 is on its way to the Human Services Finance Committee. Thank you, Representative Claiborne, for the presentation, and thank you to your testifiers for being here today.